report, which later became a book on killing Falun Gong for their organs. The government of China acknowledges that organs for transplants come almost entirely from prisoners, and the only dispute we have with them is which sorts of prisoners. They say it's all prisoners sentenced to death and then executed, and we say it's mostly Falun Gong practitioners, but also prisoners sentenced to death. And both sources, of course, are wrong. And the government of China indeed even acknowledges that sourcing of organs from executed prisoners is wrong. The government of China set up a donation system for the first time last year in March 2010 in 11 cities as a pilot project. And there was a report in Beijing today in March of this year telling us how that donation effort worked. And what Beijing Today reported was in that year, in those 11 cities, in total there were 37 donations. In Nanjing, they had 12 people working full-time to encourage donations, and in that year, those 12 people got 3 donations. So the ratio between staff and donations is 4-to-1. So that highlights how much China is reliant on prisoners for organs for transplants. The drug companies have been involved in both sales and trials of immunosuppressive drugs in China. In terms of sales, Sandoz, which became Novartis, started selling cyclosporin in 1983. Roche opened up a factory for Celsep, an immunosuppressive drug, in 2006. And the head of Roche was asked by a newspaper why China, and the answer he gave, and I quote, is, "In China there were no ethical or cultural stoppages for transplant medicine." The Canadian company Isotechnica has developed a commercialization agreement for the drug voclosporin, and that was in 2010. And the sale of these drugs, of course, facilitate organ transplantation in China. For trials, Pfizer has been conducting. Now, to come to the conclusion that David Kilburn and I did, that Falun Gong practitioners are being killed for their organs, we relied on a number of different sources of evidence, but one of the sources of evidence was investigators' calls into hospitals. Our investigators would call hospitals, pretending to be relatives of patients that needed transplants, and ask the hospitals if they had organs of Falun Gong practitioners for sale, on the basis that Falun Gong was a set of exercises, the practitioners would be healthy and their organs would be healthy. And the investigators got denials and rejections and hang-ups, but they also got admissions throughout China in about 15% of the calls. And there's tapes of the calls throughout China. Now, one of the calls that we had, and I should say that the tapes of these calls are on the internet. They're in Chinese, but if you want to hear them, you can. But anyhow, this was the Shanghai Jiaoteng University Hospital Liver Transplant Center, and I'll just read you a bit from the transcript, the translation. The caller says, "I want to know how long the patients have to wait for a liver transplant." The doctor, Dr. Dai, says, "The supply of organs we have every day, we do them every day." Caller, "We want fresh, alive ones." Dr. Dai, "They are all alive, all alive." Caller, "How many live transplants have you done?" Dr. Dai, "We have done 400 to 500 cases. Your major job is to come, prepare the money, enough money, and come." Caller, "How much is it?" Dr. Dai, "If everything goes smoothly, it's about RMB 150,000 to 200,000. Caller, "How long do I have to wait?" Dr. Dai, "I need to check your blood type. If you come today, I may do it for you within 1 week." Caller, "I've heard some come from those who practice Falun Gong, those who are very healthy." Dr. Dai, "Yes, we have. I can't talk clearly to you over the phone." Caller, "If you can find me this type, I'm coming very soon." Dr. Dai, "It's okay, please come." Caller, "What's your last name?" He says, "Dr. Dai." Now, the transplant trials are public on the internet for the various companies, including the location where the trials are done. And all four companies, Roche, Novartis, Astellas, and Pfizer, have been doing trials at this hospital. So that there's compelling evidence that these companies are engaged in clinical trials in a hospital in Shanghai, which is sourcing organs from Falun Gong practitioners. Similarly, Tianjin, the number one central hospital, or the Oriental Organ Transplant Center in Tianjin. This, again, is an excerpt, transcript translation of the call, where we have a caller who says, "Hi, is this Tianjin First Central Hospital, Director Song?" Director Song says, "Yes, please speak." Caller. She talks about her relative and the need for transplant, and then she says about her relative. Her doctor told her that the source of the kidney is very good, as the organ supplier practiced Qigong. And Director Song says, "What type of Qigong?" And the caller says, "Falun Gong, because people who practice Falun Gong have good health." Director Song, "Of course, we have similar situation here. We have also these so-called supplier bodies that are still breathing or still have a heartbeat. We have them, of course. We ought to have some of this type. So far this year, we've probably had more than 10 kidneys of this kind." Caller, "More than 10 of this kind? You mean live bodies?" Song, "Yes, it is so." Now, the fellow who answered this call, Song Wenli, is still at this hospital, and two of the companies, Roche and Astellas, have been doing trials at this hospital. So, again, with this hospital, there's evidence of complicity. The World Health Organization has as a standard that donations of organs must be transparent and open to scrutiny. Dr. Danovich, who is here from in a bit, has co-authored an article in the American Journal of Transplantation where he said pharmaceutical companies must ensure that no executed prisoners are the source of organs used in their studies. The situation which has developed has generated a reaction already. In 2010, in January 2010, the company Roche won a Swiss award, the Public Eye People's Award, for irresponsible company practices. And that was for conducting research on transplant patients in China without knowing the origin of the organs donated. The Amnesty International has issued an appeal in August 2010 calling on pharmaceutical companies to exercise due diligence to ensure that they are not directly or indirectly implicated in taking or use of organs from prisoners. The drug company Novartis in August 2000 decided to observe a moratorium for drug trials in China, which in my view other companies should follow. The Triodos Bank disinvested from Roche in September 2010 and gave as a reason that Roche does not verify the origin of the organs in its China-based trials, and further saying that Roche's approach to clinical trials in China is not acceptable. The Dutch ASN Bank followed suit. In March of this year, they also announced that they were disinvesting from Roche because of its clinical transplant trials in China. Now, in my view, pharmaceutical companies should not be participating in criminal trials in China unless they are satisfied beyond a reasonable doubt that the organs transplanted to the patients on whom the drugs are used are received from a proper source. Doctors should not participate in these trials unless the doctors themselves ensure beyond a reasonable doubt that the organs transplanted to the patients on whom the trials are conducted are received from a proper source. Drug companies should not be selling anti-rejection drugs beyond existing levels. They, I believe, need to sell them to existing patients, but shouldn't sell them to future patients. They should announce a freeze on sales at the level necessary to meet the needs of the existing patient volume at the time of the freeze. We should not be turning a blind eye to ethical abuse. Until China respects the World Health Organization principle that organ donations are to be transparent, traceable, and open to scrutiny, neither pharmaceutical companies nor transplant professionals should cooperate in Chinese transplantation activities. Thank you very much.